Hi, today we are going to be talking about herbal medicine and what you need to know about some of the most common herbal medicines we have today. We are also going to discuss its importance in healthcare, its safety concerns when using complementary medicine, and discuss valuable resources that may be used. First up is the introduction and history of herbal medicine. So, what is herbal medicine and why is it important? Herb is a plant or a part of a plant typically used for its scent, flavor, or therapeutic properties. Herbal medicines are considered to be a type of dietary supplement that comes in forms of tablets, capsules, powders, teas, extracts, and fresh or dried plants. The use of herbal medicines is commonly used to maintain or improve one's health. It is important to know that herbal medicines are not always safe and good for everyone. Herbal medicines do not go through the same process of testing procedures the way drugs do. In addition, herbs may cause unintentional harm for consumers when it interacts with prescription or over-the-counter medicines. When thinking of using herbal medicines, it is important to first get pertinent information on it from sources that are reliable. When taking herbal medicines, it is highly recommended that you inform your healthcare provider about the use. Now we will go into the history of herbal medicine. Natural medicine, also called herbal medicine, has been around for centuries. It is commonly practiced by people who prefer to treat symptoms and illnesses with natural remedies rather than pharmaceuticals. By using the bark, berries, flowers, leaves, roots, and seeds of different plants, people who practice natural medicine are able to treat many ailments. Ancient Chinese and Egyptian writings describe many medical uses for plants dating back to 3000 BC. Traditional Chinese medicine developed many herbal therapies that were commonly used. African and Native American cultures also frequently use various herbs in their healing rituals. In fact, research has shown that cultures around the globe use the same or similar plants for the same medical purposes. In the early 19th century, natural medicine quickly evolved as scientists discovered how to extract and modify the plant's active ingredients. This led herbal medicine into the hands of chemists, who began to synthesize plant compounds. Unfortunately, this new scientific approach resulted in a decline of natural medicine as more and more people turned to pharmaceutical drugs to treat their ailments. Now, only about 25% of pharmaceutical drugs are derived from botanicals. It is important, however, to be aware of the care required for making the most of botanical extracts. If proper care has not been taken with the plants, then you might not be getting as good of a product as you were led to believe. As with any medication, it is important to consider the source when putting anything in your body. Now we will go over what you need to know before you buy any herbal products. First, you should know the label. The FDA requires the supplement labels including the following information: name of the supplement, name and address of the manufacturer or distributor, complete list of ingredients, serving size, amount, and active ingredient. And next, you should be a smart consumer. Do not just rely purely on the marketing strategy of the company selling the product. Look for objective, research-based information to make your evaluation on the claims of the products. And finally, get reliable information. Ask your doctor or pharmacist. They may be able to give you the latest medical guidance about its uses and risks that can help guide your decision on the use of herbal medicine. Look for scientific research findings. Use reliable websites and other resources that help consumers make informed choices about dietary supplements. Contact the manufacturer. Calling the manufacturer or distributor may help you gather information on questions you have regarding the claims of the products. Next, we chose 5 common herbal medicines that are widely used all over the world, starting with red yeast rice, St. John's wort, ginkgo, garlic, and soy. The first supplement is red yeast rice. Red yeast rice is a traditional Chinese culinary and medicinal product. In the United States, dietary supplements containing red yeast rice have been marketed to help lower blood levels of cholesterol and related lipids. Some red yeast rice products contain substantial amounts of monocolin K, which is chemically identical to the active ingredient in the cholesterol-lowering drug lovastatin. These products may lower blood cholesterol levels and can cause the same types of side effects and drug interactions as lovastatin. Red yeast rice claims to lower blood levels of cholesterol, improve blood circulation, and improve digestion. Mostly mild side effects such as abdominal discomfort, heartburn, gas, headache, and dizziness are associated with red yeast rice. It contains monocolin K, which has side effects including liver damage and muscle disorders or myopathy. Two studies supported by NCCIH have indicated that some people who had been unable to tolerate statin drugs because of its side effects were able to tolerate red yeast rice. It is uncertain whether the smaller amount of monocolin K in the red yeast rice products, as compared with the amounts of active ingredients in the drugs, accounted for the greater tolerability or whether other factors were responsible. Despite the FDA actions, some red yeast rice products currently on the market in the United States may contain monocolin K. Consumers have no way of knowing how much monocolin K is present in most red yeast rice products, and therefore have no way of knowing whether a particular product is safe, effective, or legal. Next is St. John's wort. St. John's wort is a plant with yellow flowers that has been used in traditional European medicine as far back as the ancient Greeks. The name St. John's wort apparently refers to John the Baptist, as the plant blooms around the time of the feast of St. John the Baptist in late June. Historically, St. John's wort has been used for a variety of conditions, including kidney and lung ailments, insomnia, depression, and to aid wound healing. It is thought to work similarly to an antidepressant drug and may increase activity of brain chemicals such as serotonin, which is important in regulating our mood. Currently, St. John's wort is promoted for depression, menopausal symptoms, attention deficit hyperactivity disorder or ADHD, obsessive compulsive disorder, and other conditions. Topical use of St. John's wort is promoted for various skin conditions, including wounds, bruises, and muscle pain. In research studies, taking St. John's wort by mouth for up to 12 weeks has seemed to be safe. But because St. John's wort interacts with many drugs, it might not be safe for many people, especially those who take conventional medicines. When taken orally for up to 12 weeks, in appropriate doses, St. John's wort is generally considered safe. However, it may also cause the following: agitation and anxiety, dizziness, diarrhea, constipation, and stomach discomfort, and dry mouth. Other side effects also include fatigue, insomnia, headache, and increased sensitivity to sunlight. There has been extensive research on the use of St. John's wort for depression and on its interactions with medications. It has been clearly shown that St. John's wort can interact in dangerous, sometimes life-threatening ways with a variety of medicines. St. John's wort appears to be more effective than a placebo, and as effective as standard antidepressant medications for mild and moderate depression. It's uncertain whether this is true for severe depression and for time periods longer than 12 weeks. St. John's wort might be helpful for menopausal symptoms, wound healing, and somatic symptom disorder, but there's not enough evidence to know for certain. There's also not enough reliable evidence to know whether St. John's wort might be beneficial for quitting smoking or improving memory for many conditions, including anxiety, ADHD, and seasonal affective disorder. Next, we have ginkgo. Ginkgo is one of the oldest living tree species in the world. It has a long history in traditional Chinese medicine. Members of the royal court were given ginkgo nuts in an effort to improve memory and slow age-related intellectual decline. Other historical uses for ginkgo were for asthma, bronchitis, and kidney and bladder disorders. It has powerful antioxidant qualities, which helps improve circulation by dilating blood vessels and making the blood less sticky. Today, the extract from ginkgo leaves is promoted as a dietary supplement for many conditions, including anxiety, allergies, dementia, eye problems, peripheral artery disease, and tinnitus. The side effects for ginkgo include headache, stomach upset, dizziness, palpitations, constipation, and allergic skin reactions. If you have a known bleeding risk, you should be cautious about ginkgo, possibly increasing your risk of bleeding. There is no conclusive evidence that ginkgo is helpful for any health condition. Although some studies suggest that ginkgo may help to slightly improve some symptoms of dementia, the findings have been described as unreliable. Also, other studies have had conflicting findings. Ginkgo does not help prevent dementia or cognitive decline, nor prevents Alzheimer's related dementia from getting worse. This is according to studies that include the long-term ginkgo evaluation of memory study, which enrolled more than 3,000 older adults and was funded in part by the National Center for Complementary and Integrative Health. For various health conditions, a small amount of evidence suggests a benefit from taking ginkgo, but the overall evidence is not conclusive. These conditions include anxiety, diabetic retinopathy, glaucoma, peripheral artery disease, premenstrual syndrome, schizophrenia, and vertigo.
Next up, we have garlic. Garlic is one of the oldest herbal products that has been used for its medicinal and culinary purposes for thousands of years. In ancient Egypt, it was used by the noble, incorporated into medicine, religious rituals, and was given as a powerful source of strength. Today, it is believed to work by protecting the body's blood vessels through its cholesterol lowering and clot inhibition effects. Thus, garlic is indicated for heart health, including high blood pressure and high cholesterol. Some side effects of oral garlic include upset stomach, body odor, flatulence, malodorous breath, and nausea. Certain individuals may experience severe allergic reactions. Topically, fresh garlic may cause burns and dermatitis. In terms of efficacy and safety, garlic is usually safe in the amounts eaten in foods. Raw garlic may be unsafe if used topically. There is little evidence concerning its use in pregnancy, and garlic taken as a supplement may interact with certain medications such as ibuprofen, naproxen, aspirin, and an HIV medication. Next, we'll be talking about soy. Soy has a broad spectrum of use. It provides environmentally friendly fuel for diesel engines, printing of newspapers and textbooks, is a high source of protein for our diet, and may work medicinally. Soy is thought to have hormonal type effects to help prevent bone deterioration, clot inhibition, and LDL lowering properties. Medicinal effects may also help prevent heart disease. Thus, soy is indicated for menopausal symptoms, bone health, improving memory, improving high blood pressure, and improving high cholesterol levels. Some side effects associated with soy include digestive upsets such as constipation, diarrhea, and nausea, insomnia, and it can also alter thyroid function in those who have iodine deficiencies. In terms of efficacy and safety, despite clinical research, there are still uncertainties regarding its use. Soy should be avoided in those who have an allergy to it. Evidence is unclear concerning soy isoflavone use in women with breast cancer, and use of soy in pregnancy should not exceed amounts greater than those used in foods. Now that we have talked about certain herbal medicines, we would like to share with you how you can take your product of choice safely. It is always important to inform your doctor or pharmacist about any herbal medicine use so they may help monitor your progress in terms of the product's effectiveness and its safety. It is also important to educate yourself. Research the companies whose herbs you are taking. Some questions that you can ask yourself are: is the product manufactured by a reputable brand? Does it have verification seals? Does the product label give information about the standardized formula, its side effects, its ingredients, its directions, and its precautions? Is there a toll-free number, an address, or a website address listed so consumers can find out more information about the product? Always follow the label's directions. Never take more than indicated on the label, and always be cognizant of any side effects or reactions that can occur. Next, we'd like to provide you with some resources to help guide your decision. The first resources you can use are your healthcare providers, such as your doctors or your pharmacists. Your doctor and pharmacist can help weigh the risk and benefits of alternative therapy to help you make an informed clinical decision, and they can help you make adjustments to your regimen as necessary. These are some free trusted resources that you can utilize. The NCCIH is the federal government's lead agency for scientific research on complementary and integrative health approaches. Medline Plus is an online health information resource for the National Library of Medicine for patients and their family and friends. USP Herbal Medicine's Compendium is an online resource that provides standards of herbal ingredients used in herbal medicines. OCCAM is responsible for NCI's research agenda in complementary and alternative medicine as it relates to cancer prevention, diagnosis, treatment, and symptom management. The USDA FNIC is a leader in online global nutrition information. A paid trusted resource that you can utilize is Pharmacist Letters Natural Medicines Database. It's an authoritative resource available on dietary supplements, natural medicines, and complementary, alternative, and integrative therapies. This concludes our presentation. We thank you for watching.